every one of the 17 editors of the American College of Cardiology journal was receiving large sums of money from big pharma. So they are not going to allow studies that poo-poo big pharma drugs into their journals.
The biggest objection that I see our colleagues have against a functional medicine approach to anything is they say, there's no data behind that. Okay. I'm going to have our top docs think about that objection and how you would answer that. And I'm going to actually show a video right now of what some of the clients who went through our program have to say about that. That objection is that functional medicine is not data driven.
Tried lots of things like many people have here, and there really is no certainty in it. It's a lot of trial and error. Yeah. So having that certainty through you and the results that are tailor-made for every person really has helped.
The thing that was really interesting was to see that it was personalized to me. I had been trying, I had been recommended all these elimination diets that generally just left me crying.
I am better, and I can see the reasons of how I've gotten better because now I know what tests to take and what the test results mean, how to interpret it, how to adjust.
So that's what some of the clients have to say about their own results and their own data. So I'm going to ask you guys, we hear this from our colleagues all the time. There's no data behind what you're doing. What's your answers to that?
I Googled functional medicine on Wikipedia in preparation for this. So I was kind of curious what Wikipedia was saying. So here's how they start this off. Functional medicine is a form of alternative medicine and encompasses a number of unproven and disproven methods and treatments. Its proponents claim that it focuses on root causes of disease based on interactions between the environment and the gastrointestinal, endocrine, and immune system to develop individualized treatment plans. It's been described as pseudoscience, quackery, and the essence of a rebranding of complementary and alternative medicine.
That's what they're reading, and that's what our colleagues are reading.
That turns my stomach, actually. That really does. You know what? That was written by Pfizer.
Well, exactly. And Robert, how would you answer that?
It's very easily data-driven. Just go to PubMed. Any one of us, we're all smart people, and you don't have to be that smart. Although I will say sometimes it's difficult to parse through, scientific papers. But there are functional medicine journals out there, and sometimes you have to be your own N of one. I know my lab's changed. A couple of my patients who have run through my leaky gut solution program, I've had people's kidney function improve. I've had inflammatory markers improve.
Blood pressure, C-reactive protein. Yeah. You name it, right? I actually think I do more testing now than I ever did as a conventional family medicine doctor.
And, Maggie, you brought up another good point about evidence-based medicine. I hate to say it, it's garbage. It's been proven that all of the journals and all of the governing boards are all bought by big pharma. There was a study a couple years ago that showed that the journal from the American College of Cardiology, they have 17 editors. Okay, the editors are responsible for what's going to get it published and how it's going to be published and so on and so forth, right? Every one of the 17 editors of the American College of Cardiology journal was receiving large sums of money from big pharma in the hundreds and hundreds of thousands of dollars a year. So they are not going to allow studies that poo-poo big pharma drugs into their journals.
Yeah. I think that the idea that there's no data has to start from the question of how are we defining data and how we're defining the study and the study type, who's being studied and what's being studied, what outcome is being studied. And so when we kind of stick to the strict study guidelines of a double blind randomized placebo-controlled style study, is going to be very hard to put the ideal of personalized medicine type of study structure. And so when we also incorporating things like wellness and optimal health into the equation of outcomes, that's not something you easily measure in those type of studies when you're just trying to see if a drug works. Those drugs are not designed in some ways to get a person back to optimal health and wellness. And so I think we're looking at two different outcomes in the study format. And so when they say there's no data to support that, is that we're largely looking to see a very different outcome, not just a reduction or a change in the lab value, but how a person ultimately gets back to loving, working, relating, and playing in life.
Happiness.
Those are the
Happiness.
5 criteria that we really want to ultimately see.
Absolutely. Well said, sir.
What are your thoughts about data, especially since acupuncture isn't traditional in a field that use a lot of quote unquote standard data sets?
Yeah, because traditional Chinese medicine doesn't use lab work, but
Right.
there's a very specific pulse taking method, and there's a lot
Yeah.
that we do from observational work. And in fact, even in our functional medicine training, they say you can diagnose 90% of conditions just from an interview. And I think that's really fascinating. Well, I spend 2 hours, Robert, he says he spends 90 minutes with his patients doing an intake. So we're really getting a lot of information from our patients when we do our initial interviews. I think we're already getting a lot of data just from all the information we're getting from our patients. But then the great thing about the lab work that we do is we can find those underlying causes that are maybe hidden, that you can't get information from otherwise. Like, how bad of a gut infection do you have? How many gut infections do you have? Do you have leaky gut?
That's the real question.
Yeah. So in Chinese medicine, you can't really get that from an interview. You need the lab work for that. Or even adrenal function testing. Like, there's some corollaries in Chinese medicine of adrenals. But when you actually do the lab work, I can read like, okay, you have very, very bad adrenal exhaustion. Not just like, oh, your body's, maladapted a little bit. It's like, oh my goodness, your adrenals are tanked. We're going to need to spend 12 months fixing this, not just like, oh, 2 or 3 months fixing this. And so I like that data because it gives us some objective information about the prognosis as well.
Yeah. So for me, like, I think one of the biggest things is that functional medicine absolutely is data driven. In fact, it's more data than conventional medicine. We have even more training than regular doctors do around this. And I think data is actually crucial. If you think that you have something that could benefit from a functional medicine approach, type it in chat right now. I would love to hear what that is. You could get some feedback. We have thousands of resources, interviews, trainings, case studies to be able to share with you. I want this information accessible for everybody, but we're not going to be able to get it to you if you don't raise your hand. So go ahead in the comment section, raise your hand, tell us more about you, and we'd love to get to know you more.